Surgeon scientists are incredibly important for the future of medical care in the United States. And so if we don't train our surgeons to be scientists as well, we won't have people in the research arena that are able to address issues that patients face. And that's been one of our priorities, is to be able to raise money mainly to support young people as they're beginning their career, and that includes residents, even medical students, and certainly fellows and junior faculty who are starting their career, because we realize how important it is for them to have some money to generate preliminary data that will then lead to a successful and bigger grant application.
By studying the care that people get to the outcomes that they experience, outcomes research has really become key to improving the quality of care. What I see in the future is using the hypotheses that we've generated from our institutional experiments to sort of broaden the impact on a more state or national level. And that is ultimately where I see this research going. Funding for clinical or outcomes research in my world would definitely help me create large institutional databases as well as access national databases, so I can not only generate the hypothesis but then apply it more nationally. It would also allow me to conduct prospective trials on interventions that we have created and follow them forward longitudinally. And finally, and probably most importantly, it would allow me to set up scholarships for other young surgical scientists to continue to pursue this kind of research, which is so important in our field.
Philanthropic support specifically for young faculty and for those that will become young faculty is imperative. So as a recruitment tool and a retention tool, I think is one of the paramount issues that we face as leaders in the surgery department. We have an obligation, I think, to support our young faculty and help them get started and move on to more mid-career faculty that involves research and clinical care. And the ways we can do that are with support from our clinical revenue, but that only goes so far. We really need the help of external funding sources, including the government, foundations, and philanthropy. And that's critical to us in terms of the development of these faculty, really that are the cornerstone for the future of the Department of Surgery.
Philanthropy has impacted me very personally. When you come as a young investigator and you're trying to build a research program and trying to build the infrastructure to sustain that research, it is a very daunting task. If you look at what's happening and you turn on the news or you read a newspaper, you see that there's slashes to NIH budgets, there's a reduction in scientific funds available for research. And then as a young researcher, you're competing against very senior researchers who've built up very impressive apparatuses to conduct research. And so a young person such as myself or a beginning career investigator oftentimes will not have much of a chance at the NIH against these individuals. And so philanthropy personally has played a role, has allowed me to build a very strong research program. It's allowed me to conduct significant investigation into these interesting questions that we have about transplant, and it's built these two laboratories that we have here. And without that, we would not be where we are today. It gives people that have good ideas, it gives people that have innovation in their kind of blood, so to speak, the chance to compete with these seasoned investigators. As a physician, I can help a patient, one patient at a time. I do an operation, I do a transplant, that helps one patient at a time. I can go back into the laboratory and I can think of an idea and I can hone that idea and I can improve that idea where I can help thousands of patients at once. It gives me a chance to increase my impact. And that's, I think, the reason that all researchers do what we do, is that we want to have a profound impact on society and individuals, and I want to help as many people as I can. Every dollar that you give, every resource that you give can cure untold numbers of people in the future. And so what we're really working with is we're working on the future. We're thinking about all those people we can help in the future. And that doesn't just happen by accident.
Having funding from philanthropy along with extramural funding that's peer-reviewed is critical, particularly in this day and age as funding becomes more and more competitive to achieve. The role of philanthropy to help cover some of these gaps is absolutely critical, and many research programs, including our own, would have to stop functioning were it not for the possibility of philanthropic contributions.
I came to OSU to be a translational scientist. Being at a place like this allows me to treat the disease that I'm interested in and also use those observations to develop lab-based treatment modalities and investigations. Philanthropy is important, especially for somebody like myself who's a junior investigator, because it gives us the seed money to develop our ideas. We come in highly ambitious with good ideas, but with the funding situation the way it is, it's difficult to get our research off the ground. Philanthropy is really the way to do that.
It's my responsibility.
I am making a commitment.
I am paying it forward.